Okay, good afternoon. I would appreciate if member states can take their seats. We're going to start the next session very soon. Okay, welcome back to the afternoon session. We're going to proceed on to our next agenda item 11, which is on neglected tropical diseases, document WPR/RC69/5. May I call upon the Acting Director Program Management to introduce this item?
Thank you, Chair. Distinguished representatives, I'm pleased to present document WPR RC69/5 on neglected tropical diseases. As you know, we've made significant progress in recent years working together to combat neglected tropical diseases, or NTDs. In fact, you'll have noticed that we've had together more successes validated since the working documents were sent out in August. Since 2016, a total of 9 more countries in the region were validated as having eliminated lymphatic filariasis as a public health problem. And 2 more countries were validated as having eliminated trachoma as a public health problem in 2017. The burden of schistosomiasis has also been reduced to the point that regional elimination is now within reach. These successes have been largely the result of mass drug administration campaigns. This approach can control and eliminate some NTDs. But other NTDs require more comprehensive responses. For those, we must adopt multi-sectoral interventions and strengthen surveillance coordinated within the overall health system. This 2-pronged approach to accelerate control and elimination of NTDs is the basis of the new draft Regional Action Framework for Control and Elimination of Neglected Tropical Diseases in the Western Pacific. The framework was informed by 2 years of consultations with member states and other experts and partners. There's no question about the need for such a framework. 1 or more of 15 NTDs targeted are endemic to 28 countries and areas in this region. The most affected are hard to reach and marginalised populations. People living without access to adequate sanitation, basic infrastructure and health services are particularly vulnerable. Fighting these diseases goes hand in hand with our mission to achieve universal health coverage. This will ensure that health services reach the most marginalised and neglected populations so that no one is left behind. The good news with NTDs is that we have the tools to finish the job. We have proven elimination strategies and we have large-scale donations of medicines. And most importantly, we have you, member states with decades of experience and a real commitment to protect people from the ravages of these preventable diseases. Your commitment will save millions from needless suffering, everything from ill health to blindness and disfiguration to stigma and death, all caused by NTDs. As always, WHO will continue to work closely with member states to help accelerate control and elimination of these diseases. The Regional Committee is invited to consider for endorsement the draft Regional Action Framework for Control and Elimination of Neglected Tropical Diseases in the Western Pacific. Thank you, Chair.
Thank you, Dr. Jacobs. We will now take interventions from representatives who wish to speak on this item. May I call upon the representatives from Japan?
Thank you, Chair, for giving the floor. We appreciate the efforts made by the WPRO Secretariat for preparing the draft Regional Framework for Control and Elimination of Neglected Tropical Diseases in the Western Pacific to further strengthen measures for limiting NTDs. We support this proposed draft framework as well as the proposed draft resolution. NTDs, which disproportionately affect the vulnerable populations, are considered as major obstacle to poverty reduction and social development in the developing countries. To achieve UHC and leave no one behind, we need to deliver medical care to socially vulnerable populations and to regions where it is difficult to access medical services due to economic and geographic problems. Thus, Japan has been actively contributing to filariasis program in the Western Pacific region. To promote R&D and supply of NTD drugs through public-private partnerships, Japan has funded the Global Health Innovative Technology Fund in 2013, which is jointly operated by the Bill and Melinda Gates Foundation and pharmaceutical companies. Specifically, our country has been continuously investing in promising new NTD drug development projects, including ones for leishmaniasis and Chagas diseases. Owing to globalization and climate change, there's a strong possibility that areas where no such diseases were prevalent in the past will experience NTD outbreak. In 2014, we experienced a dengue fever outbreak in Tokyo in some 70 years. This is a good example of such possible concerns to think about, which needs to be tackled by the whole region. In this regard, Japan will continue to participate actively in the initiatives for eliminating the NTDs. Thank you for your attention.
Thank you, Japan. May I call on the representative of Lao PDR?
Thank you, Mr. Chair, for giving Lao delegations to give remarks. The Ministry of Health of Lao PDR therefore strongly support the endorsement of this regional draft actions frameworks, and we are committed to continue our fight against neglected tropical disease. First of all, on behalf of the Ministry of Health Laos, we would like to express our sincere thanks to WHO, international organizations such as FSI 360s, MEC Foundations, USAID, RTIs, ADB, JICA, as well as all the development partners for providing both technical and financial support to our country. Without that, we won't be able to achieve what we are now today. La PDR have achieved elimination of trachoma last year, 2017, and elimination of lymphatic filariasis and schistosomiasis mekongii are also considered within reach in the next couple of years. However, several other entities such as dengue, which is remaining a serious health threat to our countries throughout the years, since many years, as well as leprosy, continue to be important of public health problems. In schistosomiasis mekongii, prevention control with the support from WHO and government of Laos, local authorities, communities, and other development partners, we have empowered the community in affected areas by establishing a sea air wash committees or a community-led water sanitation and hygiene to ensure sustainability of this project, even when donor support comes to an end. In soil-transmitted hand means, the Ministry of Health has also seek close collaborations with other ministries, such as school health programs that have been very successful. An MOU was signed between two ministers, Ministry of Health, as well as Ministry of Education and Sports. But we also seek advocacy with local authorities to assist in communicating with communities to better understand the problems and seeking the community leaders in supporting our intervention and our cause. However, despite this success, many of the remaining entities are zoonotics and foodborne, such as rabies, opisthocaisis, teniasis, cysticercosis. Public health alone, we cannot achieve it. Therefore, we give our focus to multi-sectoral partnerships, such as animal and agricultural, as well as environmental sectors, and community engagement to accelerate control and elimination of the remaining NTDs. It is fully in line with the strategic pillar of the draft of the regional action frameworks for control and elimination of NTDs in our Western Pacific region. Thank you very much, Mr. Chair.
Thank you, Lao PDR. May I call on the representative of the Philippines?
Thank you, Chair. The Philippines appreciates the report of the WHO Secretariat and their work in coming up with the Regional Action Framework for Control and Elimination of Neglected Tropical Diseases in the Western Pacific. Given the successful implementation of the Regional Action Plan for NTDs in the Western Pacific 2012 to 2016, which urged the elimination or control of 7 NTDs, the Philippines supports and endorses the draft Regional Action Framework. In the Philippines, we are happy to share that of the 80 provinces in the country, there are already 38 provinces declared as filariasis-free, 49 areas are rabies-free, and 42 provinces as malaria-free. The fight against NTDs is a journey to ensure that the most marginalized and neglected populations are equitably reached by appropriate health services, and no one is left behind. Therefore, we commit to sustain and enhance our efforts to accelerate control and elimination of NTDs through WHO's continued support and by pursuing a whole-of-system, a whole-of-government, and a multi-sectoral approach. Thank you.
Thank you, Philippines. May I call on the representative of China?
Thank you, Mr. Chair. The Chinese delegation would like to thank the Secretariat for providing us this progress report on the control and elimination of neglected tropical diseases, and we congratulate on the progress made. However, we are keenly aware that we are still faced with many challenges. China has been engaged in the promotion of control and elimination of neglected tropical diseases. China has eliminated lymphatic filariasis in 2007, but still there are the incidences of certain NTDs. We agree with WIPRO's further action plan and will adopt holistic approaches, engage multiple stakeholders, provide community-based services, enhance laboratory capacity building, and boost the surveillance so as to promote the prevention and control of NTDs. As to this regional action framework, China finds that this framework is highly relevant to the regional challenges. In particular, this region has the world's highest level of waterborne and foodborne parasitic disease burden. It is urgent for us to have collaborative efforts to be engaged in research and control. In recent years, China has established the zoonotic helminthiasis network with Asian countries. And this network has celebrated its 20 years of anniversary in 2018. After 20 years of joint collaboration, we have done a lot of work in prevention and control. We've also put forward the scenario of eliminating schistomiasis and the control of opisthoraciasis in this region. We will also hold certain training programs on the vector-borne, waterborne, and foodborne NTDs so that we can be engaged in better joint control and joint prevention work. Besides, we hope that the WIPRO can continue with further financing and technical support and enhance the accessibility and affordability of the relevant drugs. We hope WIPRO can help certain countries to enhance their innovative research capacities so as to facilitate the process. Thank you, Mr. Chairman.
Vanuatu.
Thank you, Mr. Chairman. Vanuatu wishes to acknowledge WHO's commitment to eliminate entities in the WIPRO region and congratulate countries who continue to meet the call of elimination of entities. In Vanuatu, more than 80% of population live in the rural areas. Hard-to-reach areas, dictates of travel and means of transport can be through very rough terrains and high seas. The choice to access sufficient and clean water may be affected by various factors such as isolation, habitual locations, or simply cultural behavior of cleanliness and poor hygiene practices. Limited access to health services remain unchanged for decades despite effort to expand. In 2016, Vanuatu received WHO certification for lymphatic filariasis elimination. The continuous decrease of entities such as trachoma, yaws, soil-transmitted disease and leprosy is greatly due to a focused program intervention by mass track administration, tireless effort to ensure the provision of sufficient clean water supply and improved surveillance system. Strong emphasis in the country entity strategic plan is to incorporate key interventions such as case finding, treatment and provision of clean water through WASH program. Strong links with key stakeholders within government such as education and water resource department is of priority to ensure sustainability of achievement. Ongoing partnership support to maintain long-lasting effect of program implementation strategies, such as provision of drugs and sanitary items for hygiene purposes, is commendable. Mr. Chairman, Vanuatu is committed to progressing on with elimination efforts of NTT and therefore fully endorse the draft regional framework for control and elimination of NTT in the Western Pacific region. Thank you.
Thank you, Vanuatu. May I call on the representative of Australia?
Thank you, Chair. This is our first intervention today, so I wanted to mention how much we enjoyed the dinner last night and thank Dr. Shen for his hospitality. We very much enjoyed being part of the performance with our neighbours in the Pacific region last night, but I should tell you that we're already planning the grand Australian performance for next year. Australia thanks the Secretariat for its work in developing the draft regional framework for control and elimination of neglected tropical diseases in the Western Pacific. We commend the significant progress that's been made by countries in our region towards the elimination of priority neglected tropical diseases. Australia supports the draft framework and its dual approach to building on these achievements. In Australia, we're working hard to reduce rates of trachoma and crusted scabies in our Aboriginal and Torres Strait Islander communities. Good progress has been made, with the overall trachoma prevalence rate in screened 5 to 9-year-old Aboriginal children decreasing from 14% in 2009 to 3.8% in 2017. However, some hotspot communities remain and trachoma control efforts will focus on these communities. We're using cross-sectorial arrangements to implement local solutions and utilising environmental health staff to work with trachoma-affected communities to promote health hygiene activities and environmental improvements. We are also accelerating our efforts to target the elimination of crusted scabies by improving its detection, treatment and management. Australia looks forward to being an active partner in WIPRO's work to combat neglected tropical diseases. Thank you.
Thank you, Australia. May I call on the representative of the Republic of Korea?
Thank you, Chair. The Korean government would like to congratulate WIPRO for its progress in the control and elimination of neglected tropical diseases and will endorse the draft regional framework for control and elimination of neglected tropical diseases in the Western Pacific. In particular, Korea shows its support for the twin approaches as proposed in the draft to accelerate control and elimination of NTD through the use of existing interventions and to encourage adoption of multi-sectoral interventions and strengthen the surveillance coordinated within the overall health system for NTDs. In the Republic of Korea, soil-transmitted helminthiasis has been well controlled. However, foodborne dermatodiasis is prevalent in limited areas, particularly near and around rivers in the southern part of the country. In line with WIPRO's effort, the Korean government implemented the National Program for Control of Clonorrheiasis in 2005 to inform local residents in such areas on proper eating habits, with an emphasis on avoiding the consumption of raw fish. As a result, infection rate of clonorrheiasis decreased from 9.1% in 2005 to 4.8% in 2017, and we are actively pursuing continuous efforts to fight clonorrheiasis. Finally, we would like to bring attention to the need for updating evidence-based materials, such as standardized guidelines and detailed policies, and for providing sustainable support to strengthen human resource capacities. Korea is eager to share experiences of parasite management with other countries and will continue to support the control and elimination of NTD in this region. Thank you.
Thank you, Korea. May I call on the representative of the Federated States of Micronesia?
Thank you, Chair. The Federated States of Micronesia, FSM, would like to thank WHO and all our partners for your continued assistance and support in our efforts to control and eliminate neglected tropical diseases within our region. Lymphatic filariasis, soil-transmitted ailments, and leprosy are some of the key neglected tropical diseases that remain endemic in FSM. Over the past years, FSM had been focusing on preventive chemotherapy to control and eliminate these neglected tropical diseases. The number of lymphatic filariasis cases in FSM had decreased over the years. Recently, FSM implemented 2 rounds of mass drug administration campaign in 2016 and 17. A follow-up sentinel spot check survey will be undertaken to determine if we will proceed with additional rounds of MDA or continue with the transmission assessment survey in the next few years. FSM requests WHO and our partners continue technical assistance support in our effort to eliminate lymphatic filariasis in FSM. FSM is also implementing the warming and vitamin A campaign in schools every 6 months over the past several years. However, we do not know how current prevalence rate for soil-transmitted ailments. And for this reason, Mr. Chairman, FSM requests WHO technical assistance support for a national survey to be conducted in FSM in order to understand the true prevalence rate of STH in our region. The rate of leprosy in FSM is still high at 180 to 100 cases per 100,000 population. FSM is not reaching our elimination goal of prevalence rate of less than 1 case per 100,000 population. For this reason, FSM requests for additional technical assistance and financial support from WHO and partners to strengthen our efforts in control, reduction, and elimination of leprosy as a public health problem in Federated States of Micronesia. Mr. Chairman, given neglected tropical diseases are included in the Sustainable Development Goals, universal health coverage will be key for neglected tropical diseases control and elimination in FSM by ensuring that such needed health services reach all our people, particularly our far isolated and hard to reach outer islands population. FSM therefore support additional efforts to gradually expand focus from dependence on preventive chemotherapy to combining preventive chemotherapy with whole of system multi-sectoral approach such as improvement in water, sanitation, hygiene, food safety, environmental health, and veterinary public health, in addition to health services to accelerate control and elimination of NTDs. Finally, Mr. Chairman, FSM endorses the draft regional framework for control and elimination of neglected tropical diseases in the Western Pacific to serve our guide in progressing control and elimination of neglected tropical diseases in our region. And Mr. Chairman, FSM would like to express our sincere appreciation to our donor partners who have been helping us in our effort to eliminate all these neglected tropical diseases. And I thank you, Chair.
Thank you, FSM. May I call on the representative of Mongolia?
Thank you, Mr. Chair. Mongolia acknowledges and supports the draft regional action framework for control and elimination of neglected tropical diseases in the Western Pacific region. In Mongolia, where exposure to animal is high, echinococcus is the most widespread disease among neglected zoonotic diseases in Mongolia. And we are regarded as one of those countries with high prevalence of echinococcosis. We do have a guidance for control and prevention of echinococcosis, which was approved in 2017. But we lack sufficient surveillance system for control and prevention for this disease in the country. So therefore, Mongolia would like to request the WHO's technical support for building capacity and building surveillance-based system for echinococcosis, as well as other zoonotic diseases control in the country. Thank you for your attention.
Thank you, Mongolia. May I call the representative of New Caledonia?
Merci, Président. Donc, la Nouvelle-Calédonie remercie le secrétariat pour la rédaction du projet de cadre d'action régionale pour la maîtrise et l'élimination des maladies tropicales négligées dans le Pacifique occidental. Pour ce qui est des maladies tropicales négligées, si l'élimination de la filariose lymphatique est quasiment en voie d'achèvement, la Nouvelle-Calédonie n'en demeure pas moins vigilante depuis la résurgence cette année de cas de lèpre dans le nord de la Nouvelle-Calédonie. Cet état de fait témoigne de la persistance d'un réservoir de germes, d'où la nécessité de maintenir la vigilance et même de renforcer localement le programme calédonien de lutte contre la lèpre dans certaines localités de la Nouvelle-Calédonie.
In New Caledonia, where prevalence exceeds WHO's endemicity threshold. Therefore, New Caledonia approves the draft elimination of the draft regional action framework for the control and elimination of neglected tropical diseases in the Western Pacific, and will ensure its implementation like other countries in the Western Pacific. Thank you for your attention.
Thank you, New Caledonia. May I call on the
Je vous remercie. Je donne à présent la parole au représentant de Samoa.
Mr. Chairman, Samoa wishes to acknowledge and endorse the draft regional action framework for control and elimination of neglected tropical diseases in the Western Pacific. We further note the Secretariat's arduous work in developing yet another regional framework for our use, and the learning and reminders must be lived in our daily lives. I would like to start by saying that we must always take time to celebrate our achievements. Given this particular agenda item, I wish to congratulate the 6 countries of our region that were recently validated for elimination of lymphatic filariasis as a public health problem, namely New Caledonia, Cambodia, Cook Islands, Niue, the Republic of the Marshall Islands, the Kingdom of Tonga, and Vanuatu. It is important to always take stock, and much appreciation is to be accorded to the Secretariat for providing the country-specific briefing notes for all countries, which gave us a snapshot of the current status and main issues of NTDs that we need to prioritize. For Samoa, we needed to intensify our mass drug administration undertaking in August this year, and to strengthen our resolve by already planning for another campaign next year, given the high prevalence of lymphatic filariasis identified at the post-MDA surveillance in 2017. In addition, this year's MDA campaign was enhanced by including the ivermectin drug with the intention of covering scabies and other ectoparasitic infections as well. It is a reminder that we should never be complacent and that the control and elimination of NTDs does require comprehensive multi-sectoral collaborations and a definite paradigm shift. The continuous support of WHO and the Secretariat is acknowledged for facilitating Samoa's MDA campaigns. For our part, we will need to step up our efforts in ensuring that the needed health services and health promotion related to such campaigns reach all people, particularly those who are still ignorant of the importance of these endeavors. Let me finish by saying that it is easy to forget when a challenge is met or when a battle is won. But if we are to remember the stigma and discrimination associated with NTDs in small societies like ours, and the fact that some of the interventions like the provision of safe water, sanitation, and hygiene can be easily obtained within our own means without having to wait for the WHO intervention, then we should never forget. Our responsibility to now generations of our region is more crucial than ever before. And it's urgent to address the unfinished business of NTDs with tools already at our disposal. I thank you, Mr. Chairman.
Thank you, Samoa. May I call on the representative of Brunei Darussalam?
Thank you, Mr. Chair. Assalamu alaikum and good afternoon. Mr. Chairman, fellow delegates, ladies and gentlemen, significant progress has been made at the global level to combat the threat of NTDs and improve the lives of millions worldwide. Despite these achievements, however, we know that there still remain pockets of communities in affected endemic countries that lack basic awareness, health literacy, and knowledge of transmission of the most common NTDs. As a result, prevention and control among some groups remain challenging. The government of Brunei Darussalam notes that continued regional effort in tackling some of this residual resistance to elimination of NTDs. One area of progress in our country has been the work done to eliminate lymphatic filariasis. Despite a national prevalence of less than 1% of microfilaria, we identified a number of sub-districts where prevalence was slightly above 1%. In order to fully assure ourselves that the threat has been eliminated, in February 2013, we established the National Lymphatic Filariasis Elimination Program to provide mass drug administration to all residents in these sub-districts and in the neighboring sub-districts. Each MDA was subsequently followed by a drug coverage survey to assess the uptake. By the end of 2016, a total of 3 MDA rounds were completed. Several monitoring and evaluation activities were undertaken after the completion of such campaigns. These include an LF prevalence survey in selected sentinel and spot check sites and a transmission assessment survey of all school children aged 6 to 7 years old in the areas involved in the MDA campaigns. We hope that our efforts have paid off and we are now undergoing the rigorous verification process established by the Western Pacific Regional Office. One lesson learned from this national lymphatic filariasis program is that public health interventions and services are only effective when they reach the people who need them. Their impact is sustainable when communities are engaged and are empowered to take responsibility of their own health and well-being. As such, efforts should be made to engage and mobilize, develop health literacy among communities. We are pleased to note that one of our 4 pillars in the proposed regional action framework concerns precisely this issue of engaging and empowering communities. By way of recommendation to the Secretariat, one particular area that Brunei Darussalam believes should be given more attention to in the proposed action framework is how NTD elimination can be integrated within the overall health system. Disease-specific, small-scale vertical programs for NTD elimination is not feasible in small countries with limited human resources. In addition, verification processes should ensure high scientific standards, but also be realistic, pragmatic, and focus on what is truly happening on the ground rather than merely reliance on extensive data templates. While Brunei Darussalam supports this draft framework presented today, we cannot stress enough that in the implementation of this regional action framework, the Secretariat builds into its work assistance for countries in delivering integrated and holistic approaches to this particular agenda that takes into account each country's specific context, the opportunity cost of implementation, and other pressing health needs of the member state. Thank you.
Thank you, Brunei Darussalam. May I call on a representative of Kiribati?
Maori, and good afternoon once again, Chairman and prestigious delegations. In line with item 11, which looks into the region's way forward and enhance progress on addressing health issues due to neglected tropical diseases, I am delighted to share with members that Kiribati is making good progress towards lymphatic filariasis elimination. However, it is way off track and unlikely to meet some of the targets, for example, leprosy elimination. Kiribati is fortunate to receive assistance through the Pacific Leprosy Foundation, who has been providing strong support for our leprosy program, beside the Sasakawa Health Foundation through WHO. We are piloting chemoprophylaxis with single-dose rifampicin for household contacts of index cases, which is progressing well. In addition, trachoma elimination is also underway, with the second round of mass drug administration has been carried out since the second quarter of this year. We do look forward to work closely with our development partners and donors for further support and collaboration to enhance the implementation of our ongoing interventions to address NTDs. With health issues which are still required to be addressed in country due to NTDs, Kiribati fully endorses the draft regional action framework for control and elimination of neglected tropical diseases in the Western Pacific. Thank you, Chairman.
Thank you, Kiribati. May I call on the representative of Vietnam?
Thank you, Chair. Vietnam notes the draft regional framework for control and elimination of the neglected tropical diseases in the Western Pacific and highly appreciate those actions taken for urging elimination of the priority NTDs presented by the executive board. These documents have mentioned issues which are of concern to many countries, including Vietnam. Our experience shows that NTDs still are a devastating barrier to human settlement and socio-economic development. In the last 10 years, with the support from the WHO and other donors, Vietnam has achieved several successes in control NTDs, including first, lymphatic filariasis. No new infection case has been found in the last 5 years, and we are now receiving WHO's certification of the lymphatic filariasis elimination. It's recognize the efforts of Vietnam. And second, it's a trachoma control programs, active trachoma in children under 15 years old or below 2%. And this means we are able to eliminate this disease. And third, development for high-risk group like pre-school children, school-age children, and women of childbearing age. There are around 9 million anti-helminthic doses distributed to this group annually. For police infection, we have completed the mapping of the fluid infection such as fasciitis and small liver freak. Community-based intervention such as mass drugs administration for people at high risk has been successful implemented so that infection rate decreased significantly. However, Vietnam is a resource to support for NTDs control and prevention is still limited. Particularly newly NTDs classifies disease such as snake bite. We therefore have requested WHO to provide support NTDs control and eliminations. In order to scale up the control of NTDs, we would call on WHO Secretariat to support, improve fundings and technical support for NTDs to eliminate selected diseases and ensure minimum morbidities for those that cannot be eliminated. Vietnam also requests WHO to enhance collaboration with the partner to help member states control and eliminate NTDs in the region. Thank you, Chair.
Thank you, Vietnam. May I call on the representative of the United States of America?
Thank you, Chair. The United States applauds WIPRO's commitment and progress in addressing neglected tropical diseases and the notable achievements in the region, including, since 2016, the elimination of lymphatic filariasis as a public health problem in Cambodia, Cook Islands, Marshall Islands, Niue, Tonga, Vanuatu, and as we heard most recently, Palau, Vietnam, and Wallis and Futuna, as well as the elimination of blinding trachoma in Cambodia and the Lao People's Democratic Republic. Congratulations to you all. We are also pleased with the promising progress against schistosomiasis. Elimination in parts of the region is within reach. Building on demonstrated successes, the draft framework for control and elimination of neglected tropical diseases in the Western Pacific appropriately expands focus to a system-wide multi-sectoral approach, including the provision of WASH interventions, as well as enhanced service delivery, the engagement of communities, and the measurement of impact through surveillance, health information systems, and research. We support WHO's continued work to address NTDs in the region and welcome the draft framework.
Thank you, USA.
Thank you.
May I call on the representative of Cook Islands?
Kia ora, Chair and colleagues. The Cook Islands supports the draft regional framework for control and elimination of neglected tropical diseases in the Western Pacific. In 2016, the Cook Islands was validated as having eliminated lymphatic filariasis as a public health problem. However, the ongoing existence of neglected tropical diseases, including lymphatic filariasis in the Western Pacific, reminds us of our need to remain vigilant. Economic development, increasing population movements, and urbanization places additional pressure on our fragile infrastructure and threatens to destabilize good public health work. We need to continue to ensure adequate sanitation systems, quality water supplies and storage, and effective surveillance and response systems to treat and manage diseases as they arise. The Cook Islands welcomes this framework as a move towards helping eliminate these unwanted, neglected tropical diseases from the Western Pacific. Thank you.
Thank you, Cook Islands. May I call on the representative of Solomon Islands?
Mr. Chair, in Solomon Islands, at least 5 NTDs are currently on target for receiving public health intervention. Soil-transmitted helminth, trachoma, leprosy, dengue, and yos. The country is on its way to eliminate trachoma as a public health problem. The first round of preventive chemotherapy was implemented, and the post-intervention evaluation has been in progress with all, which will determine the next step for trachoma elimination intervention. Leprosy remains endemic at a low level, and the country continue
to make efforts to further reduce the elimination of leprosy as a public health. The country experienced dengue outbreak in 2013, dengue serotype 3, and 2016 serotype 2. The potential for outbreaks of dengue type 4 and 1 is there as the serotypes are currently circulating in the South Pacific country and territories. The country is also preparing for a Yo intervention. It is anticipated that this will begin in 2020, provided that the country can adequately mobilize the resources to support the operation. While donated medicine, preventive chemotherapy is currently available, the country is looking for additional external investment to support future needs. Going forward, we establish a surveillance system for NTDs for those diseases and integrate this into the health information services system to support elimination goals. Solomon Islands fully endorse the regional action framework. Thank you.
Thank you, Solomon Islands. May I call on the representative from Malaysia?
Thank you, Chair. Malaysia takes note and agrees with the report of neglected tropical diseases. We recognize the importance of controlling and eliminating these diseases due to its magnitude and impact on health and economy. The strategies to achieve the goals latest by 2030, as stated in the Sustainable Development Goals, will give an opportunity for countries to strengthen the universal health coverage. Malaysia supports and is confident that the Regional Action Framework for Control and Elimination of Neglected Tropical Diseases in the Western Pacific will guide the member states to attain these goals. Thank you again, Mr. Chair.
Thank you, Malaysia. May I call on the representative of Tonga?
Thank you, Chair. Tonga support the draft regional framework for control and elimination of neglected tropical diseases in the Western Pacific. Tonga commends the use of the 4 pillars in this framework, namely catalyzing multi-sectoral action, enhancing intervention and service delivery, engage and empower communities, and measure impacts and generate evidence. These principles can easily be applied to control elimination of NTD or to any other infectious diseases of public health significance. Tonga also wishes to take this opportunity to thank WHO and other development partners in assisting Tonga in the past years to finally verify in 2017 the elimination of lymphatic filariasis from Tonga as a public health problem. Tonga looks forward to further collaboration with the WHO and partners in the control and elimination of other neglected tropical diseases, especially mosquito-transmissible diseases, such as dengue fever, which still cause significant morbidity and mortality in the Pacific. Thank you.
Thank you, Tonga. May I call on the representative of Fiji?
Thank you, Chair. Honorable members, Fiji commends the Secretariat and the partners for the development of the draft regional framework for control and elimination of NTDs in the Western Pacific region. We congratulate the countries that have achieved the elimination of lymphatic filariasis and continue to strive in our efforts with the guidance of WHO to join this group. The draft regional framework complements Fiji's neglected tropical disease multi-sectoral action plan 2017 to 2020. We welcome the description of the 4 pillars in the plan, in particular its aim to eliminate as well as control NTDs and to alleviate the suffering in our diverse population. The framework recognizes the importance of catalyzing coordinated multi-sectoral action, and this is reflected in our unique WHO Health Promoting Schools program that is kindly supported by the Government of Korea, which combines strategies for preventing non-communicable diseases and neglected tropical diseases in close collaboration with our other major partner, the Ministry for Education. Fiji is also one of the countries investigating the feasibility of MDA using oral ivermectin for the elimination of scabies and is currently in the planning stages for the MDA in 2019. We also welcome the framework's recognition of the importance of community empowerment and measuring impact in control activities for NTDs. Fiji endorses the draft regional framework for control and elimination of neglected tropical diseases in the Western Pacific region. Thank you, Chair.
Thank you, Fiji. Are there any more representatives from member states who wish to speak on this topic? If not, I understand that there are representatives of non-governmental organizations who wish to make a statement to the committee. Both written and oral statements will be uploaded to the designated web page and the meeting app. Just to repeat the disclaimer, as statements reflect solely the views of the NGOs concerned, it follows that statements do not necessarily reflect the views of the World Health Organization, including its member states and secretariat. It is my pleasure now to call on the representative of Médecins Sans Frontières, Ms. Su Myat Han, to make a short statement to the regional committee. Kindly restrict your statement to not more than 3 minutes.
Thank you, Chair, for the opportunity to deliver this statement on behalf of Médecins Sans Frontières. MSF, we welcome the commitment of member states in the Western Pacific region and appreciate the action taken by the WHO Secretariat on the development of the regional framework for control and elimination of the neglected tropical diseases in the Western Pacific. NTD are a group of diseases that overwhelmingly affect the poorest of the poor in many countries, but that have long been vastly underfunded and under-researched. MSF strongly welcomed the WHO classification of snakebite as highest priority of NCD in June 2017, and welcomed the inclusion of NTD as a priority in the WHO Draft 13 General Programs of Work. MSF would like to highlight the key action that the WHO Secretariat and the member states should take the initiative to address the major challenges stay ahead on the path to curbing the NTDs. First, to enhance support to program providing care and treatment for the people with NTDs. While prevention is the goal, it is not always possible. So expanding access to proper diagnosis, care, and treatment for people with NTD remain crucial. Second, to develop access policy for the NTD health products, including the NTD diagnostic, that do not fit the donation-based solution. Third, international partners must continue to support NTD initiatives that are strategic in the region, for example, including the Global Strategic Plan to eliminate human death from the dot-mediated rabies by 2030, and endemic country must increase political commitment, including the domestic funding. Endemic country must step up resources to fight NTDs, support for strengthening general healthcare system, surveillance, and outbreak responsiveness in a low and middle income country, especially in the rural setting, is also crucial. Fourth, to ensure access to the quality drug, vaccine, and antivenom by intensifying work to control the quality and allocate adequate sustainable funding for the WHO pre-qualification program, which is critical to reducing the use of the substandard drug and ensuring the new, safe, and effective NTD drug enter the market. And finally, global health R&D funder in the Western Pacific region should prioritize the promising research and development agenda for the NTDs, ensuring the affordability and accessibility to those who need them. Thank you, Chair.
Thank you, Ms. Su Myat Han. In addition, a written statement to the regional committee was submitted by WaterAid. May I now call on the Secretariat to respond to the points that have been raised?
Thank you, Chair. And once again, I'll seek your permission to ask my colleague, the Acting Director of Communicable Diseases, Rabi Abeyasinger, to make some comments, and then I'll come back and make a couple of comments with your permission at the end.
Thank you, Chair, and thank you, Dr. Jacobs. I'd like to start by acknowledging the support expressed by the representatives of the member states here for the draft regional action framework for NTDs. This framework builds on the success we have achieved in the region. And I like to take this opportunity to start off by acknowledging that that success would not have been possible if not for your commitment, your government's commitments that have made that possible. We are happy to note the progress that countries have made. And we also want to acknowledge the support of donors, particularly the governments of Japan, the United States, and the Republic of Korea, who have helped in this effort to eliminate neglected tropical diseases from many of our countries. In addition, I want to acknowledge here that the huge support we receive from the pharmaceutical industry through the drug donation program. Within the Western Pacific region and beyond, we have been providing preventive chemotherapy up to 1 billion doses last year. And this is a huge support that the industry provides to WHO to facilitate the achievement of the NTD targets. And I want to acknowledge that support here. We have listened to the comments and the concerns of member states and the opinions of experts in drafting this regional action framework. And it clearly builds on the success that you have achieved in your countries. And that is why we are proposing a two-pronged approach to the next few years in tackling NTDs. We want to help countries in their efforts to achieve elimination of those diseases that can be eliminated because we have effective treatments and because we can move rapidly towards achieving those targets and removing the stigma and suffering of those marginalized populations. At the same time, we recognize that there are other diseases that require solutions beyond mass drug administration. And so we're recommending a multi-sectoral approach going beyond health, which fits in well with the Sustainable Development Goals and working across sectors to achieve the success. And as rightly pointed out, we have and we will continue to work with you to move that multi-sectoral approach. And we look very much to your leadership in countries to reach out to those other sectors to gain the momentum necessary to actually achieve the results that we are aiming to achieve, to reduce the suffering and the stigma of people affected. We recognize and we hear the concerns of many member states regarding dengue and the possible impacts of climate change. I wish to remind the honorable members here that the regional committee endorsed a regional action plan for dengue, recognizing the singular importance and burden of dengue to this region in 2016. And since its endorsement at the regional committee, the Secretariat has been working with member states to address the challenge of dengue and reduce the impact of dengue on health and countries in the region. Similarly, we are aiming to partner you in your efforts as we expand focus and as we improve our focus on the eliminatable diseases and expand focus on the other diseases where we wish to work with you, with other partners and with donors so that we can mobilize adequate support to address the multi-sectoral challenges that prevent us effectively controlling the other neglected tropical diseases that require these. I would also like to acknowledge that in the NTD arena, we have new challenges with the addition of scabies and other ectoparasitic diseases and snakebite envenoming last year to the NTD agenda. Here in the region, we've given leadership to studying the situation, looking for evidence-based solutions, and we will be moving towards addressing those challenges in the near future, especially expanding access to antivenoms to reduce the burden and suffering caused by snakebite envenomation. We recognize the challenges posed by the need to address NTDs, and that is why the Regional Action Framework advocates an integrated approach where we'll use integrated health systems development to address the challenges and reduce the opportunistic cost on countries in having to deal with neglected tropical diseases. At the same time, we were looking for evidence-based solutions that will help us to hasten the progress and better measure the progress and reduce the burden on countries. For this purpose, we are advocating the use of newer diagnostic techniques that will considerably reduce time, but also newer combinations of treatment that will help us to accelerate progress towards elimination. I thank you all for your expressions of support for the Regional Action Framework, and we look forward to working with you over the next few years to make the work possible. Thank you so much.
And just briefly, Chair, just to sum up and just to highlight a couple of particularly important things, very briefly. Of course, we talk about neglected tropical diseases, but as we all understand, they're not neglected by the affected individuals or their families or their communities. These are diseases that continue to have real impacts on people's lives every day. As we've also heard from all of the efforts around the room, and you know, these are also not diseases that are neglected by the member states of this region. And that brings me to the powerful comments from the Honourable Minister from Samoa, particularly about the importance of celebrating successes. To be frank, I think we in the health sector could get better at celebrating successes. Sometimes we get caught up in the day-to-day pressures and the day-to-day demands, and we forget to take a step back and actually celebrate what our sectors have achieved. You know, often working with other sectors. So thank you for raising that. It does also prompt me to reflect, and it's something I was actually thinking about with some of the earlier technical items we've been talking about, and that is the potential importance of knowledge sharing in our region. We have a lot of expertise, of course, in the member states of our region, and just prompted by Mongolia mentioning echinococcus. Now, I know from my previous working life that Australia and New Zealand have had a lot of success in working multi-sectorally to really effectively tackle echinococcus. So I think there's a lot of learnings that can be shared around the region. And I think you know, we as an organisation probably need to get a bit better at making it easy for people to share the knowledge. The final thing I was going to say is that, I mean, as we've all heard, further elimination is absolutely achievable. We know how to do it. We have the tools to do it. But the final thing to emphasise is that elimination is not the end of the road, even for those diseases. And that's for two reasons. One is, like a lot of other communicable diseases, whilst they continue to circulate around the world, even a country that's eliminated a particular disease could still have reintroductions. So we need to have surveillance systems sort of integrated into broader surveillance that can identify if cases start to happen again. But the second thing we can't forget is that a number of these neglected tropical diseases cause lifelong disability. And so even once these diseases stop being a public health problem, they will still be a problem every day for people living with the disability. And so our systems still need to be able to provide services to those people through their lives. So thank you, Chair.
Thank you for the responses. Are there any comments or clarification? If there are no further comments, may I request the rapporteurs to draft an appropriate resolution? Thank you. We will now proceed on to the next agenda item 13, strengthening legal frameworks for health in the Sustainable Development Goals, document WPR/RC69/7. May I now request the Acting Director Program Management to introduce this item?
Thank you again, Chair and distinguished representatives. I'm pleased to present document WPR/RC69/7 on strengthening legal frameworks for health in the Sustainable Development Goals. Legal frameworks, both the instruments of law and the institutions that put them into effect, are essential to advance universal health coverage and health in the SDGs. Law can, for instance, strengthen health governance, improve access to health services, prevent and manage public health risks, and foster multi-sectoral collaboration to address social determinants of health. The scope and complexity of the 2030 Agenda for Sustainable Development demand that the use of health law be examined in a strategic way. More member states are using health law at the local, national and international levels. More and more, they're requesting WHO technical assistance to find ways to better use law to better promote health and well-being. Over the past year, WHO has consulted member states, experts and partners to develop the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the SDGs. The draft action agenda is not, of course, intended to be prescriptive. Instead, the draft action agenda offers guidance for member states in the context of their needs and aspirations. The action agenda presents a range of options that countries can consider in their efforts to prioritise areas for action, including improving processes for developing, implementing and evaluating laws for health and enhancing capacities of stakeholders. The Regional Committee is invited to consider for endorsement the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the SDGs. Thank you, Chair.
Thank you, Dr. Jacobs. We will now hear from representatives who wish to speak on this item. May I now call on the representative of Malaysia?
Okay. Thank you, Chair. Malaysia takes note and agrees with the Western Pacific Regional Agenda on strengthening legal frameworks for health in the Sustainable Development Goals. A comprehensive legal framework for health in our local context will help Malaysia to propel further in achieving and sustaining universal health coverage. A revision of current laws and regulation is required in keeping with current setting, as there is a rise of millennial issues, of which the current framework is unable to cope with, such as to manage the e-health, digital access to healthcare. This revision would also mean better support towards sustainable development in the healthcare system. Thank you.
Thank you, Malaysia. May I call on the representative of China?
Thank you, Mr. Chair. The Chinese delegation would like to thank the Secretariat for this informative and innovative report. We have the following comments and suggestions. First, we agree with the proposal that the health legislation needs to involve multiple stakeholders. This report shared China's experiences. China is developing an essential healthcare and health promotion law. Led by national legislative authorities, more than 20 administrations and dozens of experts were involved in its drafting and revision. We've also solicited opinions from the general public online, and we've received more than 30,000 opinions and suggestions. Currently, we are still revising and improving the legal text. We'd like to thank VIPRA for its support in this legislative process. We also endorse the priority issues and fields in health legislation. These help to promote the realization of SDGs. China has formulated a relatively comprehensive legal system and framework in health sector. We have 12 laws and more than 40 administrative rules. Now we are working on these essential health promotion laws so as to ensure universal access in China. As for the follow-up work mentioned by this draft, we hope to add 2 points. First, establish a regional exchange mechanism for law in health sector to share member states' experiences and information on legislation on health. Second, establish a pool of experts or an expert panel so as to provide technical support and guidance to member states in their health legislation. The connotation, the content, and opinions in this report and the member states' suggestions will provide China with great references as well. Thank you, Mr. Chair.
May I call on the representative of the Philippines?
Thank you, Chair. The Philippines commends the Secretariat for the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the Sustainable Development Goals. We are thankful that the document provides clear legislative action points for countries to pursue and implement. The WHO has been excellent in providing support, especially in terms of evidence generation and the provision of experts to assist us in this process. we highlight the need to also strengthen our advocacy beyond the health sector, especially among to develop better legal frameworks for health. Would like the recent Asia Pacific Parliamentarian Forum held in Manila this August with a site visit in the province of Bataan. As such, the Philippines would like to highlight the following. First, there's a need for WHO WIPRO to lead in advocating for good health laws and legal frameworks in the region. Number two, the WHO should continue to provide technical assistance and support in generation of evidence for priority health bills in countries. In the case of the Philippines, this would include the Universal Health Care Bill and the increase in tobacco excise taxes. Lastly, there's a need to enhance the health sector's capacity to assess non-health laws or bills that may directly or indirectly have an impact on health, such as trade agreements and constitutional charter changes. Thank you.
Thank you, Philippines. May I call on the representative of Kiribati?
Mary, Chairman and delegates, Kiribati finds the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the Sustainable Development Goals a useful guide. Thus, fully support its endorsement. Korapa, Chairman.
Thank you, Kiribati. I would like to propose to take a 15 minutes break, and the meeting will reconvene at 3:30. Thank you. Honorable Ministers and representatives, I hope you had a good caffeine break and feel energetic. Due to popular demand from the Minister of Brunei and Tonga, we're going to invite our Wipro dance company to take us through the Gangnam Style dance. Hope everyone is awake now, but in future we may need some medical coverage just in case. Okay, let's resume agenda item 13, which is strengthening legal frameworks for health in the Sustainable Development Goals. May I now call on the representative of New Zealand.
Thank you, Chair. New Zealand is supportive of the technical document which provides excellent guidance about the matters that countries should consider when developing, making, and implementing laws relating to their health systems. We were consulted on the document and are pleased to see the inclusion of a specific example from New Zealand on the importance of recognising the rights of Indigenous people, in our case, our tangata whenua Māori. New Zealand congratulates the Secretariat for the development of high-quality guidance that will be a benefit to all member states. Thank you.
Thank you, New Zealand. May I call on the representative of Singapore? Thank you, Chair. Singapore would like to commend Wipro's efforts in drafting the Regional Action Plan on strengthening legal frameworks for health in the SDGs. Laws are an essential part of public health. In the area of non-communicable diseases, legal frameworks provide countries with effective means to inform and alert populations to health risks and to influence social norms and behaviors. It is therefore not surprising that countries are increasingly relying on legal frameworks to help address risk factors of non-communicable diseases. And this is one area in which Singapore has made use of a legal framework to achieve our public health goals, and that is tobacco control. Implementation of the WHO Framework Convention on Tobacco Control is one of the targets to reach the overall health goals in SDG 3. Singapore has taken a comprehensive and multi-pronged approach to tobacco control, including public education, taxation, and legislations to control tobacco advertising and promotion, as well as to prohibit smoking in public places. The Regional Action Plan provides countries with clear guidance on strengthening legal frameworks to enhance health systems, services, and governance. The document also highlights potential action areas in which countries can tap on legal frameworks to advance public health. We have found the draft action plan to be useful and aligned to how we have been approaching the design and implementation of public health legislation. I shall elaborate on some of the key principles below. First, we recognize that laws have to be reviewed regularly to ensure that they remain relevant to the policy context and regulatory environment. We look to international best practices and evidence in formulating our tobacco control laws. Most recently, our Tobacco Control of Advertisements and Sales Act was amended last year to increase the minimum legal age for sale, purchase, use, and possession of tobacco products from 18 to 21 years. We also extended the comprehensive ban on emerging and imitation tobacco products, like e-cigarettes, to cover not just import and sale, but also possession, use, and purchase. Before that, we had amended the Tobacco Act in the year 2016 to introduce the point-of-sale display ban, which was fully implemented in August last year. Second, to ensure that the legislative framework can improve public health, effective enforcement is necessary. And there are many challenges in this area. For example, under our Tobacco Act, Singapore bans all tobacco advertisements in all forms of media, including on the internet. However, the advent of social media has brought new challenges to enforcing the ban on advertising and promotion. Like traditional print ads or commercials, social media posts may also promote tobacco products. These, however, could be incidental images rather than deliberate product placements. Resources are thus necessary to investigate and carry out enforcement. Thirdly, as legislation will affect the whole population, there's a need to consult on possible changes to the law so that views from all segments of the population can be heard and possibly addressed. We have carried out extensive dialogue with the industry in the run-up to the introduction of the point-of-sale display ban on tobacco products. There were concerns that the display ban could hurt business interests and add more cost to operations. We took in suggestions from retailers on how to mitigate some of its impact, such as allowing them to show a tax price list upon request by customers to facilitate transactions. Now, in summary, there remain many other opportunities to increase the linkages between law and public health. Singapore supports Wipro's efforts in this area and will be happy to contribute where we can. We look forward to learn from other member states on how they have used legislation to address other public health risks, such as in nutrition labeling and limiting harmful substances in food. Thank you. Thank you, Singapore. May I now call on the representative of Cambodia?
Thank you, your Honorable Chair, Honorable Minister, ladies and gentlemen. The Cambodian legal system is statute-based. There is a hierarchy of legal instruments subsidiary to the national constitution. In order to of descending important laws, royal degree, sub-degree, prakas, which is ministerial orders, decision, circulars. Cambodia has made the progress in the real order development of health regulation. To date, there are 5 laws governing the entire health and health-related sector. Those are law on management of pharmaceutical products, law on abortion, law on management of private medical, pharmaceutical, and medical aid services, law on prevention and control of HIV/AIDS, and law on tobacco control. Other health regulations are also important contributors to the public health, fostering ministerial collaboration to address key determinants of ill health, such as sub-degree number 291 on the identification of poor households, facilitating the ID poor system, and the functioning of health equity fund program for the poor. Sub-degree number 133 on marketing of product for infant and young child feeding. There has been increased attention to developing public health-related laws to support efforts toward universal health coverage and to manage public health risks. There is scope to increase the contribution of legal instruments to this aim in Cambodia, to which the WIPRO Regional Action Agenda could contribute. Recently, efforts to strengthen public health law in Cambodia, including passing of the law on regulation of health practitioners and the ongoing development of law on management of health facilities. They are critical to further strengthen registration and licensing and practice of health professionals and practitioners, and develop accreditation system for health facility to protect health and safety of public, as well as ensure quality of safety healthcare services. Despite a good progress on developing public health law and enforcement, challenges remain. These include limited institutional capacity to develop public health law, especially for specialized technical area, level of management of relevant sector in the development of relevant laws. In this regard, the Regional Action Agenda is useful for Cambodia in considering how to address these challenges. Finally, Cambodia joined with our member states to endorse the strengthening legal framework for health in the Sustainable Development Goals. Thank you very much.
Thank you, Cambodia. May I call on the representative of Lao, PDR?
Thank you, Mr. Chair. Honorable ministers, country members, representative. First of all, the Lao delegation is pleased to endorse the draft of the Western Pacific Region Action Agenda on strengthening of the legal frameworks for health in the Sustainable Development Goals. The Ministry of Health Laos have contributed and provided inputs to the Regional Action Agenda on strengthening the legal frameworks for health in the SDG goals and agree to the proposed 3 pillars, each with the 5 actions domains. To comply with the SDGs, our Ministry of Health have worked with governments of Laos and the Lao National Assembly to amend law on health care in 2015, communicable disease control law in 2017, law on vaccinations very recently, and set up a legislative mandate for the work of the Ministry of Health. At the present time, the Ministry of Health is drafting a law on health insurance to be passed to the National Assembly, and I hope that it will be endorsed as a bill. Besides, there are also non-legislative strategies, including Prime Minister and ministerial decrees and regulation that support the health systems as a whole. For example, the government of Laos is drafting on issues related to borders, checkpoints, and our ministry, we have actively participated and provided our inputs and concern how to better implement disease surveillance at these port of entries. Currently, the government of Laos is revising the penal code with the involvement of related ministries, including our ministries. Despite on these milestones, further support will be required for Laos with the ongoing review and updating of legal frameworks, especially technical support and capacities building for the Ministry of Health staff, as well as the legal department, how we go to develop the laws, etc. Support will also be required in the implementation and monitoring of the frameworks and developments of any country action agendas. And finally, we Laos welcome sharing and participate toward the country good practice, especially those which have similar political structures and functions or socio-economic developments the same level. Thank you very much, Mr. Chair.
Thank you, Lao PDR. May I call on the representative of the Republic of Korea?
Thank you, Mr. Chair. The draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the Sustainable Development Goals lying in front of us is a well-prepared document in my delegation's view, which will work well as a new good guidance for member states' further efforts to make better and more effective legal frameworks in their jurisdiction, which are more favorable to the timely and full realization of SDG by 2030. Each and every member state in this region, including the Republic of Korea, have made its best to explore and implement some of better workable international frameworks to achieve UHC for each own people. Even though there are always different circumstances and regulations across the country, it is highly timely and relevant for us to discuss a coherent approach to strengthening our own legal frameworks for health in line with SDG by seriously reflecting the draft regional action agenda, because there are still some common process of lawmaking in core areas of public health, which should be clearly legalized and uniformly implemented, regardless of each country's unique situation. For these backgrounds and reasons I just mentioned, the Republic of Korea has prioritized health and well-being in policy and lawmaking. For instance, the 1995 National Health Promotion Act has served as a backbone of Korea's health promotion policy. The Health Promotion Act prescribes the clear-cut division of roles between central and local governance and has led to establishing the National Health Promotion Fund, mainly funded by tobacco tax, which finances various effective health promotion activities across the country. In addition, Korea enacted the Regional Public Health Act and the Infectious Disease Control and Prevention Act, which help us properly regulate public health governance, effectively use healthcare services, and better prepare and respond to any possible public health emergency. All of these legal frameworks indeed provide us with an important foundation for nationwide health promotion and prevention efforts in Korea. As the draft regional agenda clearly indicates, since each country has different legal frameworks and operates under the influence of varied social and economic factors, it is true that it is difficult to achieve a uniform legal framework. Despite those different social and economic factors, it is still very clear and quite true that all member states need to reorganize their legal systems toward fully attaining UHC on the ground. To this end, it would be quite necessary for each and every member state to constantly share its own best law and regulations across the world, including this region, and achieve consistency in them and continuously update them in close step with global trends. In conclusion, the Republic of Korea fully supports the endorsement of the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the SDG by this committee. Thank you.
Thank you, Korea. May I call on the representative of Japan?
Thank you, Chair. We appreciate the effort made by Secretariat to prepare this draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the Sustainable Development Goals. In order to achieve UHC, which was clearly targeted in the SDGs, member states should take action, including the development of the legal framework to promote UHC. From our experience, we would like to emphasize the importance of utilizing private sector. In our country, the private sector is contributing a lot to achieving UHC by providing quality medical services effectively, which now covers approximately 70% of the number of beds and 80% out hospitals. On the other hand, there is a risk that the private sector may distort the healthcare system if they are left unregulated. When considering any of the factors as given in the UHC action framework developed by UPRO, such as the quality, efficiency, equity, accountability, sustainability, and resilience, the management of the private sector would be an important issue to consider. Legal prohibition, control, and provision are critical measures not only to obtain more benefit, but also manage possible risks in each of these areas. In Japan, we regularly revise our regulation for private medical institutions to make the best out of those while minimizing the possible risk. As I mentioned, the importance of strengthening such legal framework is apparent. So we would like to know how WHO will be engaged actually in each country regarding the development of such legal framework, which should be country-specific by its nature. Thank you for your attention.
Thank you, Japan. May I now call on the representative of New Caledonia?
Merci, Président.
Thank you, Chair. New Caledonia. Thanks to Secretariat for preparing the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health and the Sustainable Development Goals. The New Caledonia social model must be adjusted to the new economic situation in a resource-constrained environment under the pressure of population growth, the aging population, the NCD epidemic, medical progress, and increases in healthcare service provision with new public and private hospitals. Expenses have reached an unsustainable level. The reform of the health system initiated by the government of New Caledonia through its health care plan aims towards fulfillment. And so it is based on 5 pillars. First of all, a concerted and coordinated reform of the health system as a whole, of its business model and its governance. 2, the strengthened provision of prevention services consistent with a demand in this area in order to move toward a more efficient provision of health services for better health in the population of New Caledonia. An operational health strategy that takes into account the impact of other policies on the population's well-being through their entire life. For a citizen, user, and a civil society-centered approach, which DOCAMO Health Plan puts at the center of public policy strategy, particularly through the development of a true democracy in health by the means of continuous assessment. And 5, reform deeply embedded in the Pacific traditions and culture through the integration of a holistic dimension of health and life of the concept of fulfilled individual connected to others and to nature. Therefore, New Caledonia endorses the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health and sustainable development goals. Thank you for your attention. Thank you, Chair.
I call on the representative of Papua New Guinea.
Thank you, Chairman. Papua New Guinea welcomes the Secretariat paper to the RCM on strengthening legal frameworks. The paper is thoughtful and well-researched, and it raises the profile of law as a health system intervention of real potential to shape the health system reforms. It identifies the use of legal framework as essential to the achievement of SDGs, stating that they are needed to address core areas of public health, governance and stewardship, access to services, protection of rights, and management of public health risks. Papua New Guinea response to the paper is not theoretical. The Papua New Guinea health sector is currently active in the area of law reviews and reform. Papua New Guinea is presently undertaking legislative reform in several areas and welcomes a regional discussion which may assist countries undertaking legislative reviews. Papua New Guinea is currently undertaking a review of all health sector laws and sometimes outside the health sector which affect health governance and service delivery. It is a once-in-a-decade opportunity to better support Papua New Guinea health system by laws which establish good governance across national and sub-national levels and simplified and coherent laws about establishment of the health facilities and their responsibility for public health service delivery. In recent years, Papua New Guinea has also thought about customary law and made innovative use of its, enabling village communities to use customary law to address the use of sale of tobacco products, including local markets in the village settings. The paper acknowledges the complexity of law reform and takes a practical approach in asking and answering three questions in relation to use of law to achieve SDGs. What can be done, how to do it, and who is involved? Papua New Guinea wishes to introduce a note of caution about recommendations which suggest review or reform to be made across a region, which includes some of the world's most populated countries and some of its smallest and least populated. The region is home to rich and diversity. There are different governments, types, legal systems, cultures, political environments, and fiscal capacities. Papua New Guinea acknowledges the value of regional leadership and guidance in this area, but emphasize the importance of an approach which avoids recommending that every country adopt a similar approach or undertake a broad-ranging reviews of laws with a view to advancing achievement of the SDG. Laws which advances the achievement of UHC and SDGs do not stand alone. They are laws which advance health sector governance, health financing, quality standards, health practitioners registrations, and so forth. This paper is very respectful of country context and thus acknowledge the dangers of imported legislative solutions, but the recommendations may be strengthened to guard against these dangers. A carefully researched and considered approach such as the one we see in the paper can begin a regional discussion to develop regional knowledge and expertise in the use of legal frameworks, which maximize its potential and help avoid many of the risks. Papua New Guinea proposed a regional collaboration led by WHO has a great potential to be a catalyst for progress in better understanding and more strategic use of legal frameworks to support meeting countries' health systems priorities, including sustainable development goals. Thank you, Chair.
Thank you, Papua New Guinea. May I call on the representative of Cook Island?
Kia ora, Chair and colleagues. The Cook Islands supports the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the Sustainable Development Goals. Legal frameworks are an integral part of society and have the ability to contribute significantly to our national, regional, and global efforts to achieve SDG 3 to ensure healthy lives and promote well-being not for all at all ages. The benefit of legislative tools in protecting the health of populations is established. We have made major advances in reducing the impact of road traffic crashes and injuries and related disability and death through legislative road safety measures such as speed limits, drink driving, and the use of seatbelts and helmets among motorcycle riders and child car restraints. Such legislative tools also need to be evidence-based and contextualized to the country settings. What works in one country does not necessarily mean it will work in another. In 2016, the Cook Islands was able to pass legislation regarding the compulsory use of helmets for young motorcycle riders aged 16 years to 25 years. This followed 2 previous failed attempts to legislate compulsory helmet use among motorcycle riders for all ages. Current Cook Islands helmet legislation supports the evidence, which is that the majority of motorcycle-related crashes and related injuries and deaths involve young males aged 16 to 25 years. Given that the determinants of health lie largely outside the health sector, we understand our need to work alongside other government and non-government agencies as well as our communities, and the importance of strengthening public health legislation to ensure it is relevant and responsive to modern public health threats. As an example, with the NCD and obesity epidemic we are facing in the Pacific region, the Cook Islands is supportive of the decision at the Pacific Heads of Health meeting in April this year to develop a Pacific legislative framework to address NCDs. This is expected to align with and complement existing strategies relating to tobacco control and other NCD-related risk factors. Thank you.
Thank you, Cook Island. May I now call on the representative of the United States of America?
Thank you very much, Chair. The United States is pleased to speak to this proposed regional action plan on strengthening legal frameworks for health in the Sustainable Development Goals, and to address a number of issues in relation to it as the region considers its endorsement. First, we do know that and we heard that there were consultations with member states and territories as well as experts. That was not the case for the U.S. One request for the future, and this is specific to this significant action plan as well as a general point, that we would ask that there be a more standardized approach to consultation so that there are no gaps in the future in relation to development of regional strategies and action plans. The action plan addresses a legal framework approach for achieving public health objectives, defining legal frameworks as the instruments of law and the institutions responsible for putting them into effect. Countries have a variety of legislative, non-legislative policy options and programs for the betterment of public health and for their efforts toward achievement of the Sustainable Development Goals. The action plan notes common challenges in the region concerning laws in place that are no longer consistent with the public health evidence or conflicting or not consistent with international obligations. We've heard recognition around the room that there is not necessarily a similar approach to be taken by all countries on this. This is a tool, so we would look at it in that way. Country contexts are highly important when we are talking about legal action, legal frameworks. For the U.S., obviously there's a number of things that we've done, and we also support appropriate regulations and capacity in a number of areas. Some of these are spelled out in the report, but the safety and quality of our medicines and vaccines and food supply, and earlier today, health facilities, safe hospitals, all very relevant to the issue. use of law and legal measures is an important option. Countries need to be able to freely consider, to look at also the time and costs associated with different approaches. The effective routes for action within health and other sectors, using the public health evidence, working with different sectors and stakeholders to affect change. This includes the private sector across different areas in the public health space, including voluntary measures. For instance, there is a terminology in there to dangerous products, a term we note is undefined in the action plan. As the region takes this forward, we recognize it as a tool and look forward to further discussion. Thank you.
Thank you, USA. May I call on the representative of Australia?
Thank you, Chair. Australia supports the draft action agenda and thanks the Secretariat for their work in preparing it. We're pleased that it recognises the diversity of legal systems across the region and acknowledge that different approaches to strengthening legal frameworks will be needed to meet the context of each country. Legal frameworks are an important tool to enable progress towards achieving the Sustainable Development Goals. For example, legal frameworks have a critical role in ensuring the safety, efficacy and quality of medicines and medical devices in our region. Australia has a mix of voluntary and regulatory measures to protect public health and safety. We're comfortable that the action agenda caters for our approach and expect it also to cater for the varying approaches which will be appropriate in the different countries. Australia reiterates that in strengthening or implementing any legal framework, it's important to provide sufficient flexibility to allow for adoption of internationally harmonised standards and requirements where this is appropriate. Thank you.
Thank you, Australia. May I now call on the representative of Vanuatu?
Thank you, Chair. Vanuatu recognize the benefit of strengthening health services delivery through effective legislation for the advancement of health outcomes in the SDGs. Existing laws such as NESAS Act, Health Practitioners Support Act, provide necessary legal arms for setting and maintaining standards of safe practices. On the other hand, Public Health Act, if fully enforced, is a source of revenue drive for government through non-compliance and excise taxes. Needless to say, strong enforcement on food, tobacco, and alcohol legislations directly impact on illnesses related to NCDs. However, the limitations of existing acts lie on effective implementation, coherence with other related laws, and capacity to enforce. The implication, if not having amendment to current acts, will continue to limit enforcement, cause unnecessary budget liabilities due to negligence, and contribute to unsafe environment or pollution when inappropriate infrastructure is not in place, such as sewage systems, especially in city and town settings. Vanuatu appreciate the commitment by WHO on the working document and endorse the draft Western Pacific Regional Action Agenda on strengthening legal frameworks for health in sustainable development goals. Thank you.
Thank you, Vanuatu. May I call on the representative of Vietnam?
Thank you. Thank you, Chair. Vietnam fully agree with the draft WPR action agenda on strengthening legal framework for health in the SDG. Vietnam currently considers several important laws, such as law on medical service, law on disease prevention, law on health insurance, law on control of alcohol abuse. And the challenge of the country is the process of developing the law, the quality of law, and the consistency amongst several laws, and also the influence of the industry. It would be really useful if WHO could support to develop and provide guidelines for Vietnam to improve the above issue. And one of the most important actions from WHO is to support member states to high-level leader advocacy. For example, tobacco control law and alcohol abuse control law. Thank you.
Thank you, Vietnam. Last but definitely not the least, may I call upon the representative for Brunei Darussalam.
Thank you, Chair. Brunei Darussalam reiterates our commitment to the 2030 United Nations Agenda for Sustainable Development. In particular, effort has been made by the Ministry of Health alongside our partners to meet SDG 3 to ensure healthy lives and promote well-being for all at all ages. We continue to make full use of legal frameworks to that effect, and over the recent years have introduced legislation such as the Tobacco Order 2005, the Infectious Disease Act 204, and just last year, the government of Brunei Darussalam gazetted the Allied Health Professions of Brunei Darussalam Order. In view of its importance as a tool to regulate decision-making and behavior, we welcome the effort by the Secretariat to develop guidance on how legal instruments can be used more effectively. There are three specific areas that Brunei Darussalam would like to highlight with regards to this. Firstly, it is important to bear in mind that when new legislation is developed from the outset, implementation of said legislation must be considered in parallel, such as responsibility for coordination, monitoring and enforcement, clarity of offences and penalties for non-compliance, resource requirements and development of new skills, which could require additional budgetary requirements to the departments in question. Secondly, equally of importance is the need to review the existing legal frameworks. Laws and administrative policies can become out of date if not regularly updated, leading to situations where the law is unable to respond effectively to current challenges and risks. This requires monitoring and evaluation of the effectiveness of the policies and law in question by policymakers and other stakeholders. However, with limited expertise and capacity, such undertaking can be challenging and lengthy. The development of such capacity in effective development, implementation and evaluation of law to advance health must receive adequate attention, and this cannot be seen solely as the job of the legal profession. There is a need to strengthen capacity so as to bridge the divide between policymakers, those involved in the implementation, and the legal experts to ensure full recognition and optimal use of law in public health. And finally, legal mechanisms on their own will not automatically result in change that is needed to support the health agenda. The success of health-related legislation depends on multiple factors, an important one being the engagement of the public as the key stakeholder. This is why legal instruments that address health must go hand in hand with systematic efforts to improve health literacy and community outreach. One example in Brunei Darussalam is the implementation of sections in the Infectious Disease Act, which mandate that individuals who may be at risk of certain communicable diseases of public health concern, such as tuberculosis, are subject to mandatory investigation and treatment. In implementing this, we also ensure that we have ongoing strategic communication campaigns to influence norms and attitude. An important component of our strategy is the identification and use of social and cultural institutions, including village heads, NGOs, and other community groups where appropriate to facilitate better regulatory and health outcomes. Brunei Darussalam hence commends the Secretariat for their presentation of the proposed Western Pacific Regional Action Agenda on strengthening legal frameworks for health in the Sustainable Development Goals. We look towards the regional and country office for context-specific support to further this agenda. Thank you, Mr. Chair.
Thank you, Brunei Darussalam. Are there any other representatives from member states who wish to speak on this topic? If not, I understand that there is a representative of non-governmental organization who wish to make a statement to the committee. Once again, statements will be uploaded to the webpage and the conference app. And as always, statements reflect the views of the NGO and not necessarily the views of World Health Organization, including its member states and the Secretariat. I'm now pleased to call on the representative of International Federation of Medical Students Associations, Mr. Po Chin Lee, to make a short statement to the Regional Committee. And kindly please restrict your statement to not more than 3 minutes.
Mr. Chairperson, distinguished representatives, I'm speaking on behalf of International Federation of Medical Students Association. First of all, we would like to appreciate Dr. Shin for his dinner last night. We have enjoyed a lot. Besides, we want to congratulate Dr. Kasai for his nomination as the next regional director. We look forward to keep providing more youth perspectives to the region in the upcoming 5 years. The International Federation of Medical Student Associations would like to again point out the importance of realizing health in all policies. The UN SDG function as a regional guide for a better future. As a future healthcare providers, we affirm that inclusive youth engagement in working toward the 2030 agenda is of utmost importance on all levels of development, ranging from local initiatives, policy creations, to high-level decision-making processes. In addition, we emphasize that health is an all-encompassing aspect of sustainable development. However, success in achieving Goal 3, good health and well-being, will depend on gains made in the other 16 goals, including ending poverty and hunger, ensure clean water and sanitation, as well as promoting educational, economical, and gender equality. This ambition itself requires the coordination of different governmental sectors and NGOs. The traditional legal concepts are not enough for nowadays challenges and needs anymore. Therefore, the International Federation of Medical Students Associations calls on governments to the following actions. First, spare no efforts on realization of the SDG's 17 goals through its 169 targets. Second, invest funds and human resources in initiatives contributing to the implementation of the SDGs. Third, ensure youth representation in decision-making, implementation processes, and official delegations to SDG-related events. Fourth, adopt the health in all policies approach, systematically and implicitly taking into account the health implication of decisions by facilitating and encouraging collaborative work among diverse ministries and bureaus. The implementation of this ambitious agenda requires partnership not only between governments and civil societies, but between governments themselves. In addition, a multi-sectoral approach to implementation is crucial. Health in all policies should be applied, and we recognize and commend this in this agenda item. To better achieve the SDG, all stakeholders should be involved, not to forget about fostering and growing a generation of engaged and committed youth is a direct investment in those who are going to achieve the SDGs for your countries. I look forward to keep working with you as youth for this region and this country. Thank you.
Thank you, Mr. Lee. May I now call on the Secretariat to respond to the points that have been raised?
Thank you, Chair. And again, I'll seek your permission to ask my colleague, the Acting Director, Health Systems, Peter Kelly, to start off with some comments.
Thank you very much. And once again, thanks to all of the delegations for providing such relevant and timely comments. I first may start with this action point, as well as the establishing of a unit that deals with health law within WIPRO, was in direct response to the countries. We've had overwhelming demand from countries to provide greater guidance and greater technical assistance around the concepts of health law, and more specifically, how can it advance towards UHC and UHC towards Sustainable Development Goals. I'd also like to review that this document essentially is in 3 different groupings. One is some of the tools that are potentially available for use in enabling a country to progress towards UHC and SDG goals. The second is around some of the processes involved. And the third is around some of the actors that should be involved. If I may comment just on the first grouping, there is obviously some movement away from the more traditional use of law in health, from disease surveillance to other arenas such as tobacco control, health insurance, as well as even more direct relationships with using law to help obtain SDG goals in itself. I'd also like to note among the grouping of what are the processes involved in tying in law with health and the Sustainable Development Goals, that there was mention on numerous occasions by member states around the necessity for reviewing existing legislation. In addition, around looking at the review, implementation was mentioned on numerous occasions, as well as monitoring and evaluation. The third area around potential actors who could be involved in the law and health agenda were parliamentarians. Now, this has been mentioned on a couple of occasions. We are very proud of our movement led by the regional director in engaging parliamentarians with health. And in fact, this effort is being looked at by other regional offices for inclusion within some of their efforts. The third is more direct responses to requests from member states. There is we heard over and over again the need for some regional cooperation. This could exist from an exchange center all the way up into a pool of experts, more of a regional pool of experts, but keeping in mind that there's a regional approach, there could be a regional approach, but also the critical need of it has to be country specific. This was reiterated and is something that we're quite sensitive to within this document. I'd also like to just comment on for a moment about our willingness to investigate the practicalities of providing assistance around law and how we can be better involved in advancing towards UHC. Again, keeping in mind country specificity and at the same time trying to take as much of a regional approach as possible. To respond to the question around how would we possibly do this, one potential way would be around topic. We've been investigating how we can take a regional approach at the same time, also be sensitive to country context, possible organization around topics. We will continue to advocate for the use of law in advancing towards universal health coverage, as well as towards sustainable development goals. Just a few last comments. It is well noted the need for a standardized approach to consultation for regional RCM items. It is also well noted and will be investigated and looked and reviewed about the comment around dangerous products that are insufficiently classified in the document. And with your permission, Chair, I certainly would like to invite my predecessor to comment further.
Okay, thank you very much. I really do appreciate the comments that have come from the member states. The document does very much draw on the experiences that we have had and also the processes of discussion. There's really only two words I want to emphasize, I think, to take away from this, and that is context and evidence. I think when we look at how the use of law has evolved, it has been historically one of the core tools of public health. And it is absolutely one of the really important core instruments available to governments. But how it's exercised does differ in context. And now we have the context of the SDGs. So we need to also think about how we use that in a different public health context, one that recognizes the intimate relationship between health and development, the reciprocal relationship between good health and good development, hence the importance of the intersectoral engagement, and aiming to achieve some sense of policy coherence, although that's more easily said than done often. I think that we also recognize the diversity in terms of the legal systems and legal institutions. in the document. But as we provide country support, we also recognize the context is actually of a moment. When a decision is taken to go down a particular path, to adopt particular forms of wording in a piece of legislation, is actually very specific to that moment. And so this is where we need to really then think about how do we generate the best evidence to learn? Because recognizing context specificity is part of that learning. So what might legal epidemiology look like? How do we do policy surveillance? How do we actually know what really is effective when we also know that the instruments of law need to be used with other policy measures, and there are different choices to be made? So I think there's a substantial agenda forward from a monitoring evaluation perspective to understand the different kinds of options that are available and what's a combination of options that work. And how do we actually then move forward, not only in the way that the health system is governed, but the way that community involvement, the participation of other sectors. The SDG is one of these learn as we go agendas. And so I think the cross-country learning becomes also a very important part of the agenda forward. So an incredibly important set of activities and events to look forward to in coming years. Thank you.
Thank you. I'd like to invite the RD, Dr. Shin, to share his thoughts.
Well, your member states, honorable delegates, maybe you had listened Dr. Professor Vivian Lin's lectures on this topic. In fact, we invited Dr. Vivian Lin when he was a well-known in public health professor in Australia. And we are very lucky, fortunate that inviting her, that we enjoyed with her relationship, this learning, this health system program for 5 years, and retired just a few months ago. But you can see her own really ideas still on as a professor. She tried to really taking this whole thing, but maybe you may not, your regional director, able to sing and dancing, but you didn't know I was one of a good professor for 32 years before joining the WHO. But I behave like a politician, but she really keeping her own really purity. But we've known each other for many years. So we are very lucky to have her. And then, well, the reason why I'm having some introduction on this about, matter of fact, I'm very proud that this topic, public health law, is introduced and in place in our Western Pacific regional, one of core kind of programs. In fact, this is only region in our whole, is my understanding correct, in whole regions, even headquarters, don't have this kind of expertism in place and systematically supporting our member state. This was when very early stage, 2009 and 2010, when I actually tried to visit whole countries and listen at what is priority need, what kind of issues we urgently support. That surprisingly, and then these law issues, one of the most important issues, each of government has a difficulty to how handle this. Because society has been constantly evolving and develop, you need some law and frames. Of course, nowhere one size can fit all, but I think we must understand, have a basic kind of understanding and how to approaching this, how to negotiate with the parliamentarians. I think this is a health minister's fundamental job, but especially when you go to small island countries. very, very difficult. Even only one Ministry of Health has only a few people working there. We cannot expect they have a whole range of expertise there. So I think this is something we started to looking at. And then I decided to have 2 full-time public health law specialists in our office. Nobody's supporting as voluntary contributions. So we decided to using this AC money to posting this as a key stop this. Well, currently we have one, just a few months ago, one person left for some other opportunity, but I think we plan to have another one coming very soon. So I hope that, well, this is almost like a school student, and we want to get some comment, kind of praise from our member state. This is really this kind of feeling. Of course, it's never been complacent. This is one initial stage of formulating this. When I just, our staff's working very, very hard to reaching this level. And then my comment is that, this is maybe very, very good material for reference material, for teaching material for school of public health. I think this is exactly, we never intended to have actually war because, reality, every country's social, political, economic situation is so different. And their way of dealing with this issue so different. So I think this is something we can offer, some kind of frame, maybe some guiding to, that I think especially we realize society's progress, there are whole different demand of legal structure, all these things. I think this will we can anticipate what will be needed in the future. But I think we see many times, we have many kind of rapidly developing countries. We see many kind of accident or some kind of episode of this kind of food security issues, drug-related some accident issues. There are many things popping up, and then they rush to go and making new laws. But I think through this, I think we have some kind of anticipation. What kind of area, which area you wanted to more looking at as a kind of priority, and then I think maybe we can have more broad range of, I think more longer term of planning about this kind of legal structure, or if you don't want to be legal structure, some kind of mechanism. Society, how can we fabricate this kind of protecting our general population for unwanted kind of effect of this thing. I think this is something we started with, and then again, I think this is something we are really, I think, appreciating your member states, your encouragement and support on this. Of course, this is maybe has to be revised and maybe time, and we hope that maybe long after my retirement, this can be something like one real booklet published by WebPro regional office. Thank you very much.
Thank you, Dr. Shin, for the words of wisdom. I must admit that I do not have professorial depth of knowledge, but if members have any queries on this topic, please do take the opportunity to challenge or question them right now. Are there any other clarifications? If not, may I request the rapporteurs to draft an appropriate resolution for this topic. Next, I'd like to thank all members for making your interventions very succinct. We have made very good progress and we are way ahead of schedule. But to live up to the reputation of high productivity and efficiency in WIPRO proceedings, we will push on to the next agenda item. Which is item 12, rehabilitation, document WPR/RC69/6. May I now request Acting DPM to introduce this item.
Thank you, Chair. Distinguished representatives, I'm pleased to present document WPR R69/6 on rehabilitation. Rehabilitation supports people who experience acute or chronic injuries and illness to recover and participate in society. Rehabilitation is key to address health priorities for all people, not only people with disability. As an essential part of universal health coverage and the continuum of care, rehabilitation promotes health and well-being for all. Health and demographic changes are sweeping the Western Pacific region, due in large measure to the rise of non-communicable diseases and rapidly ageing populations. The unmet need for rehabilitation services to promote health and well-being is substantial and growing. Efforts to strengthen rehabilitation globally are linked to World Health Assembly resolutions on disability, WHA 66.9, and the WHO Global Disability Action Plan 2014 to 2021, WHA 67.7. The draft Western Pacific Regional Framework on Rehabilitation is the first framework that draws on experience from the region to provide a foundation for countries to develop rehabilitation within their own contexts. The regional framework recognises as priorities rehabilitation service availability and quality, governance and financing, workforce development, and data and research. The Regional Committee is invited to consider for endorsement the draft Western Pacific Regional Framework on Rehabilitation. Thank you, Chair.
Thank you, Dr. Jacobs. We'll now invite representatives who wish to speak on this item. May I call on the representative from the Republic of Korea?
Thank you, Mr. Chair. The Republic of Korea fully understands that the rehabilitation has gained a growing importance and plays a larger role in health systems, as highlighted in the World Report on Disability adopted by the World Health Assembly in 2013, as well as the WHO World Disability Action Plan 2014 to 2021. Therefore, it is good news for us that WHO had the intensive consultation with the member states from December 2016 to June 2018, including a global expert consultation held this March in Manila in order to develop this draft West Pacific regional frameworks on rehabilitation. My delegation notes with high interest that a conference held at the WHO headquarters in February last year, titled Rehabilitation 2030, a call for action, has reiterated that rehabilitation is an integral part of UHC. In line with the WHO's leadership role on rehabilitation, the Republic of Korea has established and expanded access to public rehabilitation service delivery system by building regional health rehabilitation hospitals together with the local rehabilitation facilities. Korea has also developed and provided a service model that promotes social integration through rehabilitation. It is it would be quite significant for WIFRO to further help member states to implement this framework in close consultation with them and help them share knowledge and experience on rehabilitation in country-specific contexts across the region. Furthermore, it is high time to integrate each and every member state's rehabilitation services into its health system, and focus on raising the quality of life for individual countries and the region as a whole, since the aging population and rising NCDs drive up the demand for rehabilitation health services around the world. In conclusion, Korea fully agrees that the draft Western Pacific Regional Framework on Rehabilitation, which emphasizes the integrating rehabilitation services in healthcare system as an integral part of UHC, strengthening care continuity, developing and implementing guidelines on rehabilitation, training rehabilitation experts, and managing rehabilitation data. My delegation sincerely hopes that WIFRO's ongoing efforts on rehabilitation will result in making incrementally available quality rehabilitation services in the continuum of care for all people across the region. Thank you for your kind attention.
Thank you, Korea. May I call on the representative of Malaysia?
Thank you, Mr. Chair. Malaysia is committed in endorsing the draft on Western Pacific Regional Framework on Rehabilitation. Malaysia also recognizes the importance of rehabilitation as a health service for all people across the life course, along with continuum of medical care for all types of illnesses, thus supporting the attainment of universal health coverage and the Sustainable Development Goals. We acknowledge current challenges in delivering rehabilitation services in relation to increasing demands secondary to aging populations, as well as the rise in cases of injuries related to road traffic accidents, mental health issues, rare diseases, non-communicable diseases, and re-emerging communicable disease such as tuberculosis. The rise in the disabilities following short and long-term illnesses, coupled with limited data collection of rehabilitation and disability, more often than not, hinders policymakers from identifying and responding effectively. Therefore, Malaysia is resolute to the development of the Western Pacific Regional Framework on Rehabilitation. We are committed in the priorities for action, aspired around the 4 pillars lined by the WHO Western Pacific in improving the national coverage and quality to fortify deliverance of rehabilitation service in the country. Malaysia look forward to arduous collaboration with the state members in WHO Western Pacific in strengthening rehabilitation in the region. Thank you.
Thank you, Malaysia. May I call on the representative of Vietnam?
Thank you, Chair. We agree and appreciate about the Western Pacific Regional Framework on Rehabilitation 2018-2023. Now, the rise of non-communicable disease, injuries, rapid aging population in Vietnam, resulting in people living longer with chronic illness and impairment. So rehabilitation day by day is become important field. We understand that rehabilitation is generally provided by health workers. Vietnam Ministry of Health focus point in providing health services, including rehabilitation. Rehabilitation service need to be integrated in the overall service delivery package for population. Based on consulted WHO reported about Western Pacific Region Framework on Rehabilitation 2018-2023. In the next step, Vietnam Ministry of Health will adopt as soon as possible for implementation, such as first, to assess the current system of rehabilitation, to develop a process policy to deal with the rise of non-communicable disease, rapidly aging population, and the rise of injury, chronic illness, and impairment in Vietnam. Second, training to improve capacity for provision of rehabilitation services. Increase the financiation protection rehabilitation services for people with disability, patients, and people needing rehabilitation service. Third, strengthening communication and education for people. Understanding about the role and the importance of rehabilitation in the protection, care, and promotion of health, especially in prevention of disability, early detection, and early intervention. Strengthening the management in rehabilitation field, step by step complete the legal documents and policies on rehabilitation and community-based rehabilitation. Fourth, to continue the consolidate and strengthen rehabilitation network in all provinces of Vietnam. Encourage the provinces and districts where have no rehabilitation hospital to invest in the construction, hospital don't have rehabilitation departments, should establish a rehabilitation department. Thank you.
Thank you, Vietnam. May I call on the representative of China?
Thank you, Chair. Chinese delegation endorse the major content of the Western Pacific Regional Framework on Rehabilitation. We would like to thank the Secretariat and Member States for your efforts in developing this document. We are faced with similar challenges coming from NCDs and aging population. In recent years, we have developed rehabilitation-related laws and regulations, policies, and integrate the rehabilitation service into the insurance scheme, strengthen human resources development, and increase the supply of resources to increase the accessibility of rehabilitation and service. Our goal is to provide comprehensive, continuous, quality health service to the people and have healthy aging. What we have done echoes with the recommendations put forward by the framework. As for the specific content of the draft framework, we have the following comments. First, we suggest that 2018-2023 can be added to the title in order to indicate the time frame of this framework. Second, we suggest that the content and measures to increase the quality of the and the accessibility of the community-based rehabilitation service should be added. And we also suggest that we should add that WHO should provide technical support in terms of guidance and methodologies and tools in terms of the evaluation of the results of the rehabilitation. Faced with aging population and the rising NCD, in the future, China will pay more attention to rehabilitation. We will take measures to carry out rehabilitation service. We will develop national policies, expand the supply of rehabilitation service in order to increase people's life quality. Thank you.
May I call on the representative of the Philippines?
Thank you, Chair. The Philippines supports this framework on rehabilitation. This document clarifies and provides a common understanding of various concepts such as rehabilitation, community-based rehabilitation. However, we have the following comments on the draft. First, transdisciplinary approaches, which refers to the practice of crossing disciplinary boundaries to provide a broader scope of practice, such as physiotherapists being trained in the area of behavioral therapy, or fine motor skills rehabilitation should also be considered in the core actions that will support workforce development. Second, the need to emphasize the roles of frontline health workers, social workers, educators in early detection. Third, there's also a need for a framework that is rights-based and aligned with the provisions of the United Nations Convention on the Rights of Persons with Disabilities. We need WHO's guidance in operationalizing, for example, what is a human rights-based assessment of a person with disability. Finally, we look to WHO's support in the development and strengthening of the capacity of member states to provide guidance and technical support in regulating and financing provision of assistive devices. Thank you.
Thank you, Philippines. May I call on the representative of Brunei Darussalam?
Thank you, Mr. Chair. Ladies and gentlemen, Brunei Darussalam would like to commend and congratulate the WHO Secretariat and all relevant stakeholders for the hard work in developing the draft Western Pacific Regional Framework on Rehabilitation. This will serve as a good guidance for us in Brunei Darussalam to strengthen our rehabilitation services at every level. We concur with the 4 priority areas and welcome, in particular, the third pillar of the framework, rehabilitation workforce, which emphasizes the importance of trained manpower in the rehabilitation workforce. We are challenged in terms of our rehabilitation workforce in Brunei Darussalam, which limits the coverage for rehabilitation services. Effective capacity building and manpower development will assist us in supporting a whole nation medical rehabilitation services stretching from the community care level to tertiary care level, especially through allied health professions and nurses. In addition, we are now moving towards streamlining and coordinating rehabilitation services to make it accessible at primary care level so that the more complex rehabilitation cases can be seen more efficiently with further improvement on the quality and scope of rehabilitation being offered. I am pleased to report that Brunei Darussalam is working towards establishing its National Rehabilitation Center, a center of excellence for medical rehabilitation. In this regard, Brunei Darussalam reiterates our continued commitment towards strengthening our rehabilitation services as an essential part of universal health coverage and the continuum of care for all people who experience illness, injury, impairment, and ensuring an active and healthy community that remains independent as long as possible. Brunei Darussalam thanks WHO for its continued support in various areas and would greatly appreciate technical assistance in further developing our rehabilitation services. With regard to the recommendations in the draft framework, we are pleased to support for the endorsement of the draft Western Pacific Regional Framework on Rehabilitation. Thank you, Mr. Chair.
Thank you, Brunei. As we are running out of time, we will continue with the rest of the interventions tomorrow. At this point in time, may I call on the Director of Administration and Finance for the administrative announcement.
Thank you, Chair. As mentioned earlier, the informal consultation with member states, we call the caucus, will now be held in this hall. As per usual practice, the caucus is attended by chief reps and up to one alternate of member states with seats of government in the region. The consultation addresses issues such as office bearers for the World Health Assembly and nomination of executive board members. We would ask, please, that all other participants vacate the hall following adjournment of this plenary session to allow for a timely start to that meeting. And transport back to both hotels, the Manila Hotel and the Rizal Park Hotel, is available both at the end of today's session now, as well as at the end of the caucus for those that are participating there. And tomorrow's meeting again starts at 9 o'clock with transport leaving at 8:30 as it was today. Thank you, Mr. Chair.
Thank you. So the session will now adjourn and will reconvene tomorrow at 9 a.m. in the morning. Thank you.